This is a readout of the webpage What is Xanthomasma, and Xanthoma. Xanthomasma are a particular type of xanthoma. Xanthoma can appear on any part on the human body and are addressed as xanthomasma whenever they appear on the eyelids or around the eyelids. What is xanthoma? Xanthoma are fatty growths underneath the skin. These growths can appear anywhere on the body. Basically, it is a fatty growth that starts accumulating below the skin and ultimately protrudes from the surface of the skin. Xanthoma are fatty patches inside the skin. Xanthoma can vary in size. These growths may be as small as a pinhead or as large as grapes. They often look like a flat bump under the skin and sometimes appear in yellow or orange color. These are usually not painful. However, they might be tender and itchy. They can grow in clusters in the same area or several individual growths on different parts of the body. There's a picture associated to this. Where can they appear? These growths can appear anywhere on the body, but they typically form on the joints, especially the knees and elbows, hands, buttocks, feet, and around the eyes, and when they appear around the eyes, they are referred to as xanthomasma. Xanthoma may appear as single lesions or a cluster. It may develop on one part of the body or can affect different parts of the body. These lesions can appear in different shapes and sizes. Some people may have a xanthoma which is as large as grapes, whereas others can have xanthoma as small as a pinhead. Usually these lesions appear as small bumps inside the skin which may be yellow or orange color. These lesions can be itchy and may have a slight tender feeling to the touch. However, often there is no pain at all. What causes xanthoma? Xanthoma is usually caused by high levels of blood lipids or fats. This may be a symptom of an underlying medical condition such as hyperlipidemia or high blood cholesterol levels, diabetes, a group of disease that causes high blood sugar level, hyperthyroidism, a condition in which the thyroid does not produce hormones, primary biliary cirrhosis, a disease in which the bile ducts in the liver are slowly destroyed, cholestasis, a condition in which the flow of bile from the liver slows or stops, nephrotic syndrome, a disorder that damages the blood vessels in the kidneys, hematologic disease such as monoclonal gammophobic metabolic lipid disorders. These are genetic conditions that affect the body's ability to break down substances and to maintain important bodily functions such as digestion of fat. Cancer, a serious condition which malignant cells grow at a rapid pace. More about xanthoma. Xanthoma can appear on any part of the body. They are commonly growing on the Achilles heels. When xanthoma appear on the Achilles heels, they are found pressing on the tendons underneath the skin. The main peculiarity of this type of xanthoma is that it grows underneath the dermis, whereas most xanthoma are found between the dermis and epidermis. When found on the Achilles heels, this xanthoma can cause particular discomfort and to the patient. The patient may request to have them removed because they present an impediment comfort while walking and running. However, no xanthoma has a malignant growth and therefore can be left untreated without compromising the longevity of the patient. And then we have two pictures of xanthoma on the Achilles heels and the Achilles tendons. Xanthoma on the Achilles heels can keep growing if left untreated. The only treatment that is known to date, apart from the dietary and lifestyle changes, is surgery. Surgery for this type of condition is only advisable once the condition becomes too discomforting to the patient. This is because despite the simple procedure required to remove this type of xanthoma, any surgery presents risks. Achilles heel xanthoma surgery is particularly safe to perform because no general anesthetic is required unless xanthoma is particularly large. The area affected by the xanthoma is not close to any important artery. MRI and surgery. As we can see from the right picture, this picture here and the other picture, the footwear worn by the patient over time can affect the way the xanthoma develops. Surgery for removal of this type of xanthoma will lead to scarring. This is because of where the xanthoma grows on the Achilles heels inside the skin beneath the dermis itself, and therefore the scar left will be due to the deep incision required for this xanthoma removal. This xanthoma MRI shows clearly how this type of xanthoma develops inside the skin and presses on the tendons, figure A and B. Figure C at the bottom shows how this type of xanthoma looks under the microscope, quite similar to another type of xanthoma and xanthelasma. From other MRIs, from other patients' MRIs, we can see the Achilles heel xanthoma pressing on the bottom on the tendon as on the previous case. However, there is another xanthoma growth underneath the plantar heel. Given that after surgery the patient will not be capable of walking until they complete healing, xanthoma underneath the plantar heel should only be removed if xanthoma becomes particularly bothersome to the patient. The right picture shows a large xanthoma removal. The surgeon might decide to perform this procedure under general anesthetics or large xanthoma removal. This procedure will inevitably leave scarring to the patient. However, the benefits of the surgery far outweighed the small risks in this case. Xanthoma can develop in any part of the body. They have different characteristics depending on the area where it is developed. While the xanthoma on the Achilles tendons grow underneath the dermis, fortunately, when finding them on other parts of the body, they develop between the dermis and the epidermis. This therefore allows possible xanthoma removal without scarring. As we can see in this particular case, the patient affected of this is of an athletic type and does not have high cholesterol levels due to his physically active lifestyle. Xanthoma have appeared despite of his healthy lifestyle. Xanthoma on the elbow. Xanthoma on the hands. Xanthoma can also appear on the back of the hands. Removal of this type of xanthoma is possible with lasers, hyfrecator, and other similar equipment by superficial ablation. The operator can assess the risks of scarring depending on whether the xanthoma has affected the dermis. As stated earlier, with the exception of plantar xanthoma, including Achilles heel xanthoma, xanthoma develops superficially between the dermis and the epidermis. Normally, an experienced dermatologist can assess the risk of scarring by glancing at the lesion. The rule of thumb to follow in order to assess the risks of scarring after xanthoma removal procedure is that the more superficial the lesion, the less the risks of scarring. In case it is not possible to see the corrugation on the lesion, this means that the lesion could have grown deep into the skin, maybe underneath the dermis. But fortunately, this is very rare. Therefore, a deep incision is rarely required to access and remove the xanthoma, and simple superficial ablation will often suffice. This is for the case of xanthoma on the hands, and please bear in mind every xanthoma is different from each other. So let's have a look at this one. Xanthoma on chest and abdomen. And this type of xanthoma has got a particular classification, which is eruptive xanthoma, as you can see in this picture. This case is not only a further demonstration that xanthoma can appear anywhere on the body, but also can be developed by individuals that are neither overweight nor have high cholesterol levels. The xanthoma removal of this type is normally successful by simply using superficial ablation. However, given the extent of the area to be treated, it may be required a number of sessions in order to achieve complete removal. By all means, it is possible to remove all xanthoma from such a large area in a single session. The main drawback is that the relatively large extent of the burn that the patient is subjected to within the one session, such a large amount of burns could pose the body to needless stress, which should be avoided if possible. This further example shows how xanthoma can develop, also at a young age. The removal of this type of xanthoma is also sometimes possible by using superficial ablation as well as specialized peels, depending on the case. We've got xanthoma on the buttocks, and also we've got a picture of xanthoma inside the eyes itself. Let's read the text. Fortunately, this type of cases are quite rare. This young patient presented overgrown xanthoma on the buttocks. The best proposed removal solution would be conventional surgery under general anesthetic. However, an MRI would be advisable before scheduling surgery. The MRI will provide important information concerning the benign growth inside the patient body. Then we're talking about gastric xanthoma. I've got a picture of gastric xanthoma. Xanthoma are not only a skin condition, they grow on the eyes, and also it can grow on internal organs. This is a case of gastric xanthoma found by sheer chance. Of course, the xanthoma do not need to be removed as it will cause no threat whatsoever. We thank Jasmine for this kind photo. This clearly demonstrates that xanthoma are not a condition exclusive to us humans. Therefore, if you ever develop or you have xanthoma, you know that there is little to worry about. Many people have it, and also animals have it. How is xanthoma diagnosed? Your doctor or dermatologist can typically diagnose xanthoma really easily. They may be able to make a diagnosis by simply examining your skin, looking at it. A skin biopsy can confirm the presence of a fatty deposit beneath the skin. During this procedure, your doctor will remove a small sample of tissue from the growth and send it to the lab for analysis, and it will be looked at under the microscope. Your doctor will follow up with you to discuss the results. There may also be other blood tests to be taken and assess your liver function and rule out diabetes. How is xanthoma treated? If xanthoma is a symptom, not a medical condition, then the underlying cause must be treated first, if possible. This will get rid of the growth and minimize the likelihood that they will return. Diabetes and cholesterol levels that are very well controlled are less likely to cause xanthoma. Other treatments for xanthoma include surgical removal, laser surgery, chemical treatment with trichloroacetic acid. Xanthoma growths can return after treatment. However, so these methods don't necessarily cure the condition. Remember, we don't cure them that way, we only remove the condition. Talk to your doctor to see which treatment is right for you. They can help determine whether the condition can be treated through medical management of the underlying issue, which is very unlikely. Now let's talk further about the types of xanthoma. There are many types of xanthoma. Tuberous xanthoma. The tuberous xanthoma are like tumors, a collection of foamy histiocytes in the dermis. They may be associated with familial causes or acquired disorders, resulting in hyperlipidemia with no underlying medical disorder. Tuberous xanthoma occur as yellow nodules and are frequently associated to hyperglycemia, but they are also seen in patients with hypercholesterolemia. Causes of tuberous xanthoma. All xanthoma have a primary cause of elevated levels of fat on the blood and the body. This leads to excessive deposition of fat tissues, the production of foamy cells, and eventually xanthoma. Here are some factors responsible for this condition. Obesity, elevated levels of lipids and cholesterol in the blood are responsible for this condition, and that results in the availability of fats for consumption by macrophages. Hypercholesterolemia, the elevated cholesterol level in the blood, again leads to deposits of cholesterol crystals in the body, which is consumed by macrophages. I do apologize for the pronunciation. By eating them up and causing foamy cells deposition. Now, scone tendinous xanthoma, which we already actually discussed about, which is the xanthoma on the Achilles tendons. Then we've got eruptive xanthoma, which is xanthoma that can spread inside everywhere on the body, and this is it. So for more information, visit our webpage on xanthoma and xanthelasma. What is xanthelasma, xanthelasma and xanthoma?